The U.S. state of Florida is on its way to becoming the first state in the country to end all vaccine mandates, including those for school children. Florida Governor Ron DeSantis framed the decision as part of a broader push for what he calls medical freedom. He's directed state officials to prepare legislation to roll back longstanding immunization requirements. Public health experts warned the move could spark dangerous outbreaks of measles, polio, and other preventable diseases. The announcement comes as vaccination rates among children attending kindergarten in the U.S. continue to decline, and measles cases nationwide reach their highest level in decades. Well, joining me now is Dr. Peter Chin-Hong. He specializes in treating infectious diseases. He joins us from San Francisco. Doctor, it's good to have you on the program. The Florida Surgeon General today compared vaccine mandates to slavery. What did you think when you heard that?
I was really disturbed, Brent. It's really antithesis to everything we've learned in medicine, everything we know about public health, and it's definitely not a way forward if we wanted to continue the successes of vaccines in eliminating many childhood diseases in the last decades.
We also heard today that current requirements in Florida schools are an immoral intrusion that hampers parents' rights to make health decisions for their children. What do you say to that argument?
Well, when we think about why we institute vaccines for children, it's really for several reasons. The main reason is that it's not an individual benefit. It is an individual benefit, but it's mainly a community and population benefit. Mm-hmm. And you need to have enough people immunized so that people who can't mount an immune system because of immune compromise or whatever, that they will also benefit from that. Apart from that, people getting sick add to healthcare costs. We've seen that in stock form during the measles outbreak centering in West Texas and New Mexico this year. So we have multiple examples of that.
I probably, you as well, went to public schools in the United States. I don't recall anyone ever discussing not being immunized. And I recall that we never faced any threat of a communicable disease like the measles or polio. That world seems to be no more. I mean, how did we get from there to where we are now in Florida?
Well, I think what happened, Brent, is that there was a pandemic. There was, of course, a growing sentiment even before the pandemic of dropping or lowering immunization rates entering kindergarten in the United States. And the pandemic happened. People saw what they thought was a loss of freedom in the United States. Many people, draconian measures thought of by some, masking, social distancing, etc. So this, in part, is a response to that from some people. I would say it's not necessarily the majority of Americans or even the majority of people in Florida. Mm-hmm. So it's really important to disentangle what a politician is saying versus the views of the general public.
What if other states follow Florida's lead?
Well, I think one state that's thinking about it right now and has talked about it before is Texas. But on the other hand, there are also states that are taking the opposite tact. Yesterday, California, Oregon, and Washington State formed a health alliance to put science forward. And there are 8 states in the Northeast that are also thinking of doing something similar. Of course, states can only do so much. Mm-hmm. It's just like different muscles in the heart beating at different rates, and you really need a coordinated approach. But it's a step in the right direction in terms of voicing dissent to what's going on in Washington, D.C.
Doctor, what is your advice to parents still on the fence about getting their child immunized?
Well, I would say, first of all, that part of the reasons why people are even asking questions is because we've seen the success of what it's done. People say that the measure of success of a prevention strategy that works is that you don't see what you're trying to prevent because there isn't anything around. I think measles is a really great case of a canary in a coal mine. Mm-hmm. And at the end of the day, from Kaiser Family Foundation studies, people still trust their clinicians more than the CDC and federal officials regarding health. So talk to your clinician.
Yeah, let's hope we don't go back to a world in which people are afraid of catching polio like they did back in the 1950s. Dr. Peter Chin-Hong, it's good to have you on the program. We appreciate you taking the time to talk with us today. Thank you.
Thanks so much, Brent.
Pressure is mounting on U.S. Health Secretary RFK Jr. after a string of high-profile departures from the Centers for Disease Control and Prevention and the appointment of multiple vaccine critics. Kennedy was questioned at length by both Republicans and Democrats in a fiery 3-hour hearing in the Senate that at times descended into a shouting match. Florida says it will become the first state in the U.S. to end all vaccine mandates, including those for school children. Governor Ron DeSantis framed the decision as part of a broader push for what he calls medical freedom. He's directed state officials to prepare legislation to roll back long-standing immunization requirements. Public health experts warn the move could spark dangerous outbreaks of measles, polio, and other preventable diseases. The announcement comes as vaccination rates among children attending kindergarten in the U.S. continue to decline, and measles cases nationwide reached their highest level in decades. Florida's chief public health officer said no government has the right to impose vaccine mandates.
Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. All of them. Your body is a gift from God. What you put into your body, is because of your relationship with your body and your God. I don't have that right. Government does not have that right.
Florida's Surgeon General went on to compare vaccine mandates to slavery. Earlier, I asked Ofer Levy, director of the Precision Vaccines Program at the Boston Children's Hospital and a professor at Harvard Medical School, what he thinks about that.
Yes, quite a remarkable development. And look, this is a complicated topic. It brings together science, medicine, pediatrics, culture. We're a country that's diverse, that has a strong belief in personal freedoms, and libertarianism is an important strain in American history as well. So this is a complicated topic. I will say that to my knowledge, this is the first state that is moving towards doing away with all mandates. We have, of course, in some states in the United States, exemptions for religious reasons or maybe personal reasons, but we haven't seen a state go with no mandates whatsoever. I believe, as a matter of personal opinion, that in a perfect world, you wouldn't have mandates. People would make good choices for themselves and their families. However, there are very few countries that have gone this route. If I'm not mistaken, Iceland is one of them that doesn't have mandates, but they maintain very high immunization coverage because parents there trust the medical system. And I think what we have right now in the U.S. is a breakdown of trust, a poor communication between people with different views. And I would worry that to the extent that immunization rates go down for children in the state of Florida, we may see more outbreaks of measles or even the return of diseases such as polio. You know, it's hard to overstate the beneficial impact vaccines have had. Other than clean drinking water, vaccines are the most important intervention. Families 50, 60 years ago used to be afraid to let their kids swim in the summer because they were going to catch polio. When was the last time anybody was afraid of that? But as immunization rates decline and we go below the level for herd protection, we unfortunately will face more outbreaks. So this is a very delicate and important topic, and I think more thoughtful communication is needed and communication about the benefits of vaccines.
We're talking about Florida here to start with. Are you at all worried that this decision could have consequences beyond Florida?
Of course. I mean, we're talking, first of all, about children. So, first of all, the health of those children and the risk of infection for those children. But also, when they get an infection, they can bring it home and pass it on to perhaps a grandparent who's elder and might have weaker immunity, or maybe somebody in the household has cancer or is getting immunotherapeutics, so they have a weak immune system. And then, of course, infectious diseases don't respect state borders. They don't respect political parties. They just spread biologically. So, of course, whenever you're talking about infectious diseases, the decision of an individual also impacts others to the extent that the vaccine can help stop transmission.
And you mentioned herd immunity. How close is Florida and the rest of the U.S. to no longer having herd immunity? What would it take?
Well, it depends on the infectious disease you're looking at. You know, for measles vaccine, you want to see 85-90% coverage at least. And when you start dropping much below that, you'll see outbreaks, as we did in parts of Texas and surrounding states. And in fact, also in Canada, I've heard that they had a very large outbreak of late of measles as well, as immunization rates dropped. Measles is very highly contagious.
Ofer Levy, director of the Precision Vaccines Program at the Boston Children's Hospital. Thank you so much for your time.
Thank you, David. A pleasure.